how many ventures on the muscle, classification of muscle. We start learning from first topic. This is muscles of back. In Latin, musculi dorsi. Musculi dorsi divided on two groups, superficial and deep. In the superficial, we divided two subgroups. Muscle attached to the shoulder and shoulder girdle, and muscle attached to the ribs. First subgroup, muscle attached to the shoulder and shoulder girdle. First muscle. This is trapezius, musculus trapezius. It begins from spinous process of all thoracic vertebrae, ligamentum nuchae and linea nuchae superior. Point of attachment is spina scapulae, acromial end of clavicle. Function: upper part raises scapula, lower part pulls scapula down, and middle part and both all muscle pull scapula to the midline. Pay attention, I will give you name of muscle, point of beginning, point of attachment and function. This is rule of answering for muscle. Sometimes muscle has something special. Next muscle, musculus latissimus dorsi. Latissimus translate like widest muscle. Musculus latissimus dorsi. Beginning is spinous process of 4 lower thoracic vertebrae, all lumbar or sacral spinous process, crista iliaca, and 4 lower ribs. Point of attachment: fibers goes to the humerus. In the humerus, this muscle goes between humerus and body and attached to the tuberculum minus and crista tuberculi minoris. So it goes between body. So pulls arm behind. So what is the function? Function is, how remember, take something from back pocket. So adduction, pronation, extension, shoulder in shoulder joint. Point of attachment is bone, so pulls bone, shoulder in shoulder joint. Next muscle is musculus rhomboideus. Musculus rhomboideus begins from spinous process of 2 lower cervical and spinous process of 4 upper thoracic vertebrae. Point of attachment is medial border of scapula. Function: musculus rhomboideus with musculus serratus anterior form wide muscle loop to fix scapula to the body. Last muscle is musculus levator scapulae. Musculus levator scapulae begins, only this muscle begins from transverse process. Start from transverse process of second and third cervical vertebrae attached to the upper angle of scapula. Function: raises scapula. This is first subgroup. Second subgroup, muscles attached to the ribs. Only 2 muscles here. Musculus serratus posterior superior and musculus serratus posterior inferior. Superior start from spinous process of 2 lower cervical and spinous process of 2 upper thoracic. Inferior spinous process of 2 lower thoracic, 2 upper lumbar. So 2 and 2, 2 and 2. Attachment: superior attached to the ribs from 2nd to the 5, 4 ribs. Inferior attached to the 4 lower ribs. Function: superior raises ribs, inferior lowers ribs, pull ribs down. Second group, deep group. That were superficial, now deep group. Deep group, first muscle, musculi scaleni, musculi splenius, musculus splenius. Usually this muscle divided on 2. What we give you musculus splenius capitis et cervicis, et in Latin end. Why? Because there is a cross point of beginning. So like one muscle with one point of beginning. Musculus splenius capitis and cervicis beginning from spinous process of 5 upper cervical, 5 lower cervical and 6 upper thoracic, and attachment to the cervicis, neck part, attached to the transverse process of 2nd and 3rd cervical vertebrae, or transverse process of from second to the fourth cervical vertebra. It's the difference. And the capitis attached to the linea nucha superior and mastoid process. Function. We have two muscles, right and left. So it can be unilateral contraction, only right or only left contracts, or bilateral contraction, both muscles can contract. So bilateral contraction is extension of head. Unilateral contraction, abduction of head and little rotation. Okay. Next muscle. Big muscle between ribs and spinous processes. So this is musculus erector spinae. Erector is extension. We divided this muscle on three groups of fibers. First is musculi iliocostalis, musculi longissimus, and musculus spinalis. How to explain? This muscle has of fibers like tree. It starts from point of beginning and goes laterally, above and laterally. So iliocostalis begins from crista iliaca and spinous process of sacral and lumbar vertebrae. Musculus longissimus starts from spinous process of sacral and thoracic vertebrae, lumbar and thoracic vertebrae. And musculus longissimus starts from thoracic, and all muscles go above. Iliocostalis goes to the angles of all ribs. Musculus longissimus goes to the angles of upper rib, and musculus spinalis from spinous process to the spinous process, from thoracic to the cervical. Function. Bilateral contraction, extension of back. Unilateral contraction, only one head. Turns body to the side, abduction of body. And little rotation. Musculus erector spinae, another name is lateral tract. And we have medial tract. It doesn't mean one muscle is laterally, it's more laterally. But take all part, it's like superficial. And medial is deeper, but more medially. Medial tract, or another name is musculus transversus spinalis. From transverse process to the spinous process. So if you remember the name, you know beginning attachment. So, transversus spinalis. One more time. Musculus erector spinae, this heading. Musculus transversus spinalis, this heading. From transverse process to the spinous process, okay? So, and from transverse process, underlying vertebra to the spinous process, overlying vertebra. And we divided this muscle again on three groups of fibers. First is musculi rotatores, second multifidi, and third semispinalis. Semispinalis like half spinous. What's the difference? Rotatores from transverse process underlying vertebra to the spinous process overlying vertebra. Multifidi from transverse process to the spinous process above 2 or 3 or 4 vertebrae, and semispinalis above 5 or 6 vertebrae. Yes. So rotatores very close, multifidi above 2 or 3, and semispinalis is longest fibers above 5 or 6. Okay. So what's the function? Function is bilateral contraction, extension of back, unilateral contraction, abduction and rotation to the another side. Because of if you take from transverse process and spinous process and contracts, body turns to the another side, not to the same side. Okay. Last part of this topic is upper part of medial tract, upper part of musculus transversus spinalis. On the neck has its own names. And this group named occipitovertebral group. There are 4 muscles here. First is musculus rectus capitis posterior minor, rectus capitis posterior major, this musculus obliquus capitis inferior, and musculus obliquus capitis superior. How to remember names, beginning, and attachment? Musculus capitis posterior. So, direct muscle for head behind neck. Okay? And we have minor and minor. Okay? First, second, third. Musculus obliquus capitis. We have inferior and superior. This is name, okay? How to remember point of beginning, point of attachment. So we have linea nucha inferior, then we have first cervical vertebra. Name? Atlas. Does atlas have spinous process?
No.
No. What does it have? Behind. Tuberculum posterius. So, tuberculum posterius, then transverse process. Transverse process. First cervical vertebra. Does second cervical vertebra have spinous process?
No.
Yes.
Yes.
So, spinous process, transverse, and transverse. Okay? First, second cervical vertebra. So, musculus rectus capitis posterior minor. Musculus rectus capitis posterior major. Musculus obliquus capitis inferior. Musculus obliquus capitis superior. If you remember this scheme, you understand. Rectus capitis posterior minor, from tuberculum posterius of first cervical vertebra to the linea nucha inferior. Linea nucha inferior. Major, from spinous process of second cervical vertebra to the linea nucha inferior. Capitis obliquus. Obliquus capitis inferior, from spinous process of second to the transverse process of the first. And superior, from transverse process of first to the linea nucha inferior. Function all muscles, all these muscles, has bilateral contraction, extension of head, unilateral contraction, abduction of hand, and little rotation, the same side. That's all for today. And muscles of neck. You should understand what is the muscles of neck. We already learned muscles that behind the neck. This is muscles of back. Okay? So we learned only muscles here. This is muscles of neck. So now muscles of head. We have masticatory muscles. We have 4 masticatory muscles. First, musculus masseter. Musculus masseter starts from zygomatic arch and attached to the tuberositas masseterica on the mandible. Function, raises mandible, so close mouth. Next, here is musculus temporalis. Musculus temporalis starts from temporal fossa and attached to the coronoid process of mandible. Coronoid, this is process in front. Second is condylar. This muscle again raises mandible, and posterior fibers can pull mandible back. Next, deeper behind mandible we have 2 muscles. Start from pterygoid process and medial go to the mandible, and this is musculus pterygoideus medialis. To the mandible, tuberositas pterygoidea, behind angle. This muscle again raises mandible. So 3 muscles and still raises mandible. Last fourth muscle from pterygoid process and goes to the neck of mandible. Coronoid process, behind is condylar process. Condylar process have condyle and below is neck of mandible. This muscle has a different function. Unilateral contraction, shift mandible to the side. Bilateral contraction, shift mandible in front. Okay, so only this muscle can shift mandible in front. Do you remember in mandible we have, in the temporomandibular joint, we have 3 kind of movement. Open, close, one axis. Then in front, behind, so this for pterygoid lateralis. Yes, and like rotate, but it's not rotate because one joint in the one place, another joint goes in front. So this is masticatory muscle. Next, muscles of head. This is muscles of facial expression. First group masticatory, second facial expression. And muscles of facial expression have three features. First is around natural openings. This muscle doesn't have fascia except only one, musculus buccinator in the cheek. And this muscle starts from bones, point of beginning, but point of attachment not to the bones, point of attachment to the skin for expression. So, first muscle is musculus epicranius. Here is gallia aponeurotica, connective tissue tendon. And muscle has three venter: venter frontalis, venter lateralis around ear, and venter occipitalis. Venter lateralis has three parts: musculus auriculus anterior, auriculus superior, auriculus posterior. Next, muscles of face. Around ear, around eye, around orbit. You should know only names: musculus orbicularis oculi, musculus procerus for transverse folds, musculus corrugator supercilii for vertical folds. Three muscle for orbit. Then around nose, musculus nasalis and musculus depressor septum nasi. And around mouth, we have musculus zygomaticus major, zygomaticus minor, musculus levator labii superioris, musculus levator labii superioris allegui nasi, musculus levator angulus oris, I said musculus orbicularis oris, then musculus levator labii inferioris, musculus levator angulis oris, musculus transversus menti, and musculus mentalis. Only names. This is muscle of neck. Now, muscles of neck. Muscles of neck divided on three groups: superficial, middle, and deep. Superficial, only two muscles. First is musculus platysma. It's here. This muscle is right under skin. It's not present here. It goes from lower edge of mandible, above clavicle, to the second rib. From second rib to the lower edge of mandible. This muscle function prevents contraction of veins under skin. Second muscle. Second superficial muscle. Musculus sternocleidomastoidus. If you remember the name, you remember attachment beginning. Beginning by two legs from sternum and clavicle and goes to the mastoid process. Sternocleidomastoidus. Function of musculus sternocleidomastoidus. Bilateral contraction, extension of head. Unilateral contraction, because this muscle is here and contract, it turns head to the back and a little extension. So it looks like look to the sun behind shoulder. Okay? Two superficial muscle. Now middle layer. Middle layer belong to the hyoid bone. And we divide it above hyoid bone, suprahyoid muscle, and below hyoid bone, infrahyoid muscles. Above and below, four muscles. Above. First is musculus digastricus. Digastricus means two venter, anterior and posterior. Digastricus starts from fossa digastrica on mandible, goes to the hyoid bone, form tendon attached to the hyoid bone, and second venter goes back to the notch for digastric muscle, incisura mastoidea, medially from mastoid process. to venter anterior and posterior. Next, musculus stylohyoideus, from styloid process to the hyoid bone. Styloid process to the hyoid bone, stylohyoideus. Next, musculus mylohyoideus. Musculus mylohyoideus, from linea mylohyoidea on mandible attached to the hyoid bone. And musculus geniohyoideus, from spina mentalis on mandible to the hyoid bone. Geniohyoideus and mylohyoideus form bottom of oral cavity, diaphragma oris. This is suprahyoid muscle. Now infrahyoid muscle. So here we have sternum. This is hyoid bone. Between sternum and hyoid bone we have thyroid gland. Now three muscles. Musculus sternohyoideus, sternothyroideus, thyrohyoideus. Three muscles. And one more from scapula. On the scapula we have notch, incisura scapula. Close to this region we have musculus omohyoideus that goes to the hyoid bone. Musculus omohyoideus. Omo is Greek name of scapula. So, four muscles below. And deep muscle. So, here. Deep muscle. We have lateral deep and in front like anterior, but named prevertebral because it's very deep and in front of vertebral column. Lateral group. We have three muscles. All is scalene muscle. Anterior, medius, posterior. Musculus scalenus anterior. Start from transverse process of third, 4, 5, 6 cervical vertebrae and attach to the first rib. Do you remember tuberculum musculus scaleni anterioris? Muscle attached here. In front of this muscle, above clavicle, we have space. Because in front we have groove for vein, in this space we have vein, vena subclavia. Space name, spatium ante scalenum. In spatium ante scalenum we have vena subclavia. After musculus scalenus anterior, we have musculus scalenus medius. Medius starts from transverse process of all cervical vertebrae and goes to the again first rib behind groove for subclavian artery. We don't have tubercle, we didn't learn tubercle there, but there is. So attach the first rib. And between anterior and medius we have space, spatium interscalenum. In spatium interscalenum we have arteria subclavia. There is groove and artery. And last is musculus scalenus posterior. Start from transverse process of 5th, 6th and 7th cervical vertebrae and attach to the second rib. Function of all muscles, all scalene muscle, is raises ribs. So this is auxiliary muscles for inspiration. And prevertebral group. In front of we have four muscles. Musculus longissimus colli, longest muscle of neck. Musculus longissimus longus capitis, longus colli, and musculus rectus capitis lateralis and anterior. Behind we have occipital vertebral group. Rectus capitis posterior, minor and major. Here we have rectus capitis lateralis and anterior. Okay? Longus capitis and longus colli. Difference is various point of beginning and attachment. Function all muscles is the same. Longus capitis start from transverse process of cervical vertebrae and attach to the base of occipital bone, basilar part. Longus colli start from transverse process of thoracic and cervical and attach to the upper cervical transverse process. Rectus capitis lateralis start from transverse process of cervical vertebrae attached to the basilar part. Rectus capitis anterior start from bodies of cervical vertebrae attached to the basilar part. Function the same. Unilateral contraction, flexion of head, bilateral contraction, flexion of head, unilateral contraction, abduction of head. Now, what about triangles? We start talk about topography. What is topography? Not only name of structure, what structure form. One topography you already know, this is space, interscalene space and antascalene space. Now about triangles. So this is musculus sternocleidomastoidus. This is musculus omohyoideus. This is trapezius. This is clavicle. So between trapezius, omohyoideus, and sternocleidomastoidus, this triangle, omotrapezoidum. Between trapezius, sternocleidomastoidus, and clavicle, trigonum omoclaviculare. Two triangle laterally. In front, we have omohyoideus, sternocleidomastoidus, and digastricus. This triangle, there is carotid artery. This is trigonum caroticum. Between digastricus and lower border of mandible, trigonum submandibulare. In this triangle, we have very special triangle is lingual triangle, trigonum linguale. Another name is Pirogov's triangle, trigonum of Pirogov. In this triangle, you can find arteria lingualis, because of this name is lingual triangle, to close this artery if bleeding from tongue. Borders is musculus mylohyoideus posterior border of musculus mylohyoideus. Tendon of musculus digastricus, or you can say digastricus. And behind is nerve, it's not present here, is nervus hypoglossus. 3 borders. And here you can find arteria lingualis. And last triangle is omohyoideus, sternocleidomastoidus, and anterior midline. This is trigonum tracheale or omotracheale. This is first part of topography. Second part of topography is fascia of neck. Between muscles we have connective tissue that form aponeurosis or fascia. Fascia covers neck. First fascia, there is 5 fascias of neck. First fascia is external, from outside to the inside. External fascia is neck. First fascia is fascia colli superficialis. This is continuation of whole fascia of the body. It covers the neck like collar. Inside this fascia we have musculus platysma. And musculus platysma is here. Musculus platysma. Second fascia. Second and third, this is fascia colli propria. Second is superficial plate. So name is lamina superficialis fascia colli propria. This is lamina superficialis fascia colli propria. This fascia starts from clavicle and goes to the lower edge of mandible. It covers neck like collar. It starts from anterior border of sternum and anterior border of clavicle. It's important. Inside this fascia we have this muscle, musculus sternocleidomastoidus, and musculus trapezius behind. Inside this fascia. Third fascia. Third fascia, this is deep plate. Lamina profunda fascia colli propria. Lamina profunda fascia colli propria starts from sternum and clavicle and goes only to the hyoid bone. So it not covers neck, it present only here. Because looks like trapezoid body, so this fascia has name like sail, neck sail. Boat has sail for wind. Another name is Richet aponeurosis, aponeurosis of Richet. So only here. Inside this fascia we have muscles below hyoid bone, omohyoideus, sternothyroideus, thyrohyoideus, and sternohyoideus. So this is infrahyoid muscle inside this fascia. Now we have 2 fascia start from sternum and clavicle. Second start from anterior part. Third start from posterior border of sternum and clavicle. And so we have space between these 2 fascia. Space between aponeurosis above sternum. Name of space. Space in Latin spatium. Spatium inter aponeuroticum suprasternale. This space is important because of there is jugular venous plexus in this space, and damage of this space is dangerous because of minus pressure and possibility of air embolism. Next fascia. Next fascia is like inside neck. Fascia coli-endocervicalis. Fascia coli-endocervicalis contains all organs of neck: trachea, pharynx, and vessels. And this fascia has two sheets. First is parietal. Parietal translates like along walls. So this sheet covers all organs. And visceral. Visceral sheet covers every organ separately. Now we have space between two sheets. In front of this space, in front of trachea, we have space spatium pretracheale between parietal and visceral sheet of fascia coli-endocervicalis. Inside this space, in front of trachea, we have part of thyroid gland, isthmus. And this space connected with the sternum, with mediastinum. Anterior part of mediastinum. Mediastinum space between lungs, where is organs. Behind the fourth fascia, we have last fascia, blue color. This is in front of vertebral column, so fascia prevertebralis. Fifth fascia prevertebralis. Deep muscles inside this fascia. And between prevertebral fifth and the parietal sheath of fourth fascia, we have space. This space behind the pharynx. So, spatium retropharyngeale. Filled in with loose connective tissue and connected with mediastinum posterior part. So, why it's important? Because of pus can go to the mediastinum if damage of neck. That's all. This is connective tissue septum attached from the second fascia to the vertebra, divided posterior and anterior part of neck. That's all.
Not that one. Last one.
This
Fifth
This?
yeah, this one. These two.
this is prevertebral, musculus scaleni.
Oh.
This looks like it's not precise table chart. This looks like scalenus posterior. Here should be scalenus medius, and here should be scalenus anterior. And here should be prevertebral group. This is diaphragm, or another name, musculus phrenicus. Diaphragm. This is muscle fibers and attached to the center, only connective tissue in the center. This is centrum tendinum. Muscle fibers start from lumbar, ribs, and sternum. So we have lumbar part, costal part, sternal part. Sternal part start from xiphoid process, costal part start from ribs, and the lumbar part start by two legs from third lumbar vertebra, from body. Two legs goes and form openings around the aorta. This opening is hiatus aorticus. In hiatus aorticus we have tendon circle, ring, that prevent contraction. Then legs go and form another opening. This is hiatus esophageus, for esophagus, and there is no tendon around it. So diaphragm can contract esophagus. So diaphragm take part in passage food through the esophagus. In tendon center we have one more opening. This is foramen venae cava. This is vena cava inferior. Function of this muscle. This is main muscle of inhalation. Usually when diaphragm relaxed, it shaped like dome at the level of 4-5 thoracic vertebrae. When diaphragm contract, it goes down and pull with it thoracic cavity because of minus pressure there, and we inhalate. When inhalate, diaphragm is set at the level of 12 thoracic vertebrae. So we inhalate with muscle, but we exhalate only with relaxed muscles, except forced exhalation. Okay. Now try to choose the body. So thorax, we divide it on superficial and deep layer. Superficial, musculus pectoralis major. It starts from sternal end of clavicle. In front of sternum we have connective tissue from sternum and from cartilages of true hip. And also it starts from vagina around this muscle, from anterior wall of shelf. So we have sternal part, clavicle part, and abdominal part of musculus pectoralis major. It goes together and attached to the greater tubercle, tuberculum majus, and crest, crista tuberculi majoris. Function: adduction, pronation, and flexion. Shoulder in shoulder joint. Below pectoralis major, we have musculus pectoralis minor. Minor start from second to the fifth rib, goes to the scapula and attached to the coracoid process of scapula. Function: press scapula to the body. Next. Musculus serratus anterior. It starts from upper 9 ribs, goes back and attached to the medial border of scapula. With musculus rhomboidus form wide muscle loop to fix scapula to the body. And last is below clavicle we have musculus subclavius. From clavicle to the first rib. This muscle doesn't have motor function. It makes this joint strengthness, sternoclavicularis. Deep layer. Deep layer is between ribs. So we have musculi intercostalis externi at first. Intercostalis externi start from overlying rib, goes to the underlying rib. And the heading is here, like this. And this muscle not present above cartilage. So between sternum and to the ribs there is only connective tissue, no muscle fibers. So connective tissue form membrane, membrana intercostalis externa. Function of muscle. This is main muscle of inhalation with diaphragm. So it pulls rib, extend the thoracic cavity, rib cage, and we inhalate. Second muscle. Below externi we have interni, musculi intercostalis interni. Interni start from underlying rib, goes to the overlying rib. But heading is not like externi, heading in transverse. So externi, interni. Interni pulls down ribs, so exhalation. But this muscle not present from angles of rib to the vertebral column. Between them we have only connective tissue, no muscle fibers. So there is membrane, membrana intercostalis interna behind. Function of muscle. This is auxiliary muscles for forced exhalation. Yes. So we relax muscle and exhalate. If we need exhalate forced exhalation, we use muscle. Next, behind, also behind, close to the angles of rib, we have musculi subcostalis. The same like intercostalis interni, but goes over one rib. And here we have musculus transversus thoracis. It goes from sternum and xiphoid process to the ribs, from third to the sixth. This muscle also doesn't have motor function, it makes rib cage strengthens. Next is muscle of diaphragm. I already said. Here, diaphragm is here, above liver, below pericard. Yes. Next is muscles of abdomen. Muscles of abdomen are divided on anterior, lateral, and behind posterior group. Anterior, first muscle is musculus rectus abdominis. It starts from rib from 5 to the 7 and goes to the pubic bone. Function of muscle. Unilateral contraction, abduction to the same side, bilateral contraction, flexion of body. And this muscle bordered on 3 or 4 segments. Between segments only connective tissue, names intersectiones tendinous. Between right and left we have connective tissue named white line, linea alba. Second muscle, musculus pyramidalis, starts from pubic bone and goes to the white line. Function, tangent white line, linea alba. Now lateral side. Lateral side we have musculus obliquus abdominis externus. Obliquus abdominis externus. It starts from 8 lower ribs and goes to the iliac crest and pubic bone. Heading of fibers like this. Because of this heading, when contract this muscle, unilateral contraction, we turn body to the another side. So unilateral contraction turns abduction of body to the opposite side. Bilateral contraction, flexion the body. And when muscle attached to the iliac crest and pubic bone, there is the space, there is no bone, yes? So, aponeurosis of muscle without fibers, muscle fibers, only connective tissue, form ligament. So, aponeurosis goes attached to the bones and then turns and form ligament. This is inguinal ligament. So, what is inguinal ligament? Inguinal ligament, this is aponeurosis of musculus obliquus abdominis externus. Stretches between spina iliac anterior superior and pubic bone. Below we have musculus obliquus internus abdominis. Externus heading here, internus heading here. Internus abdominis start from iliac crest and 2 lateral third of inguinal ligament and goes to the lower ribs and to the opposite side. On the opposite side it attached to the muscle with opposite side and form white line. Function. Unilateral contraction, abduction body to the same side, return to the same side. Bilateral contraction, flexion the body. Last muscle behind it. Musculus transversus abdominis. Musculus transversus abdominis start from 6 lower ribs and iliac crest and again 2 lateral third of inguinal ligament and goes only to the opposite side and fuse with opposite side. Function of musculus transversus abdominis is define volume of abdominal cavity. Only this muscle corresponds with volume. Last muscle is behind. This is musculus quadratus lumborum. Musculus quadratus lumborum. Start from iliac crest, goes to the last rib. So 12 ribs. Unilateral contraction, abduction body to the same side, bilateral contraction, extension of body because of behind vertebral column. Now, anterior and lateral group form muscle wall, and these muscles form abdominal pressure, prelium abdominale. Prelium abdominale has 3 functions. First, take part in physiological acts: defecation, urination, vomiting, coughing, childbirthing. Next, motor function. We can use these muscles. And last, Abdominal pressure hold organs on the place. Next, anterior abdominal wall. We have white line. Yes. Next, when musculus transversus abdominis goes to the midline, after muscle fibers, then goes only connective tissue. And this border between muscle and connective tissue is linea semilunaris or Spigelian line. Next, this is musculus rectus abdominis, and around this muscle we have a lot of aponeurosis, form shelf, vagina for this muscle. And there is difference how form above and below navel. What is above? Above we have in front musculus obliquus externus abdominis, then half of aponeurosis of musculus obliquus internus abdominis, second half behind musculus rectus, and then we have musculus transversus. So we have 1.5 in front of aponeurosis and 1.5 behind aponeurosis. 1.5 here and 1.5 behind. What is below navel? All three muscles go in front. Behind only fascia transversa, connective tissue. And because there is difference between structure above and below, we have transverse line here. Where is navel? This transverse line is linea arcuata or Douglas line. Next, here is inguinal ligament. I said from lateral to third start musculus obliquus internus abdominis and musculus transversus abdominis. But last third is free, and there is a space above last third. And this space named canalis inguinalis. You should show only in this direction, not like this, not this, not this, only this heading. How form canalis inguinalis? So, aponeurosis of musculus obliquus externus abdominis goes and turn and form anterior wall. Behind is fascia transversa, only connective tissue. Below this is inguinal ligament. What is above? From lateral to third start to muscles, and this part is free. So muscles above and form upper wall. So upper wall of inguinal canal. This is musculus transversus abdominis and musculus obliquus abdominis internus. Now, this is exit. Enter is here, inside. And behind we have 3 folds. 5, one is median and 2 medial and lateral. Medial and lateral. So median is plica umbilicalis mediana. There is urachus, uretary duct for fetus. Then plica umbilicalis medialis. There is umbilical artery for fetus again. Obliterated. And last is plica umbilicalis lateralis. There is artery, arteria thoracica inferior. It worked now. Between these folds we have pits. Pits corresponds with exit and enter to the inguinal canal. So this is exit. So there is medial. There is enter. So here is lateral. Okay. So name of pit: annulus umbilicalis superficialis, and there is annulus umbilicalis lateralis. And little last part, last. So, musculus latissimus dorsi. Now you know musculus obliquus abdominis externus. Between them is triangle. Third border is iliac crest. Bottom of this triangle is musculus quadratus lumborum. This triangle is weak place and name is Petit's triangle. Weak place because of hernia can go to this place. And I didn't say you about diaphragm. Let's go to our room, okay? So, between lumbar and costal part, we don't have in one place muscle fibers, only connective tissue. So this looks like triangle trigonum lumbocostalis or Bogdale's slit. This is weak place. And between sternal and costal part also have little weak place, no muscle fibers, only connective tissue. This is Loray's slit, trigonum sternocostale, from lumbar to the ribs, lumbocostale, sternocostale. This is also weak places. Diaphragmal hernia can pass through these places. That's all. First is muscles of upper extremity. We have muscles of shoulder and shoulder girdle, muscles of forearm, muscles of hand. Muscles of shoulder and shoulder girdle we divided on two parts, anterior and posterior. Anterior first is musculus subscapularis. It placed in subscapular fossa. So point of beginning is fossa subscapularis, goes to the shoulder and attached to the lesser tubercle. So, do you understand? From fossa to the lesser tubercle. So, how it works? It pulls, so adduction and pronation. Okay? Adduction and pronation, function of subscapularis. Next, here, musculus coracobrachialis. Start from coracoid process of scapula and goes to the medial and a little anterior surface of humerus. Function: adduction and flexion. Shoulder in shoulder joint. Posterior group. It's a little mess with the deltoideus because it's also in front and behind. So in some sources you will find it's still anterior group. Musculus deltoideus. Musculus deltoideus. All of this musculus deltoideus. It starts from acromial end of clavicle, acromion and spina scapula, and goes to the tuberositas on the humerus, tuberositas deltoideus. So it starts very wide and all fibers goes to the tuberositas. Function: anterior fibers flexion, posterior fibers extension, and whole muscle and lateral is abduction, shoulder and shoulder joint. Only this muscle can do flexion and extension in the same joint. Next, musculus supraspinatus. Start from fossa supraspinata and goes to the greater tubercle on the humerus. Function: abduction, shoulder and shoulder joint. So it's very easy to remember, from above and abduction. Yes. Next, musculus infraspinatus, below spine, below spinal scapula. Infraspinatus goes to the greater tubercle. Start from fossa infraspinata, goes to the tuberculum majus. Function: supination. This is supination. Next, musculus teres minor, lesser muscle, lesser round muscle. Start from lateral border of scapula and attached to the greater tubercle. It goes behind the humerus. So function the same, supination. And only these two muscles can do supination, shoulder and shoulder joint. And last is musculus teres major. Teres major starts from inferior border of scapula and goes to the lesser tubercle, greater to the lesser tubercle. Function: this muscle goes in front, and this muscle, musculus teres major, greater round muscle, the same like latissimus dorsi. Adduction, pronation, extension, shoulder and shoulder joint. These two muscles, the same function. If you remember latissimus, you can remember teres major. If you remember teres major, you remember latissimus dorsi. Next, muscles of shoulder. We have anterior group and posterior group. Anterior group, musculus biceps brachii. Biceps mean two head because of this biceps. Biceps brachii start by two head, lateral and medial, long and short. Caput longum, caput breve. Caput longum goes to the tuberculum above glenoid cavity, tuberculum supraglenoidale on the scapula. Short goes to the coracoid process coracoideus. Attachment, it goes and attached to the radius, tuberositas radii. Function, flexion shoulder in shoulder joint, flexion forearm in elbow joint, and pronate forearm to set in the middle position. So, if this, it can pronate, but only to the middle position. It can pronate here, okay, to the middle position only. Next, musculus brachialis. Start from anterior surface of humerus and goes to the tuberositas on the ulna, tuberositas ulnaris. Function, only flexion forearm in elbow joint. Posterior group, musculus triceps brachii. Triceps, three head. It has lateral, medial and long head. Lateral and medial start from posterior surface of humerus. Long head goes to the tuberculum below glenoid cavity, tuberculum infraglenoidale. Attachment to the ulnar process, olecranon. Function, extension shoulder in shoulder joint, extension forearm in elbow joint. So, extension and extension. Last muscle is musculus anconeus, it's here. Start from lateral epicondyle of humerus and a little posterior surface of humerus and goes to the olecranon, very little muscle. Only extension forearm in elbow joint. Now the hard part, here. Muscles of forearm. At first we divide it on anterior and posterior group. Start with anterior. Anterior has superficial and deep. Superficial 5 muscles and deep 3 muscles. So, you see, this is radial side. Radial side. This is ulnar side. First, how to remember? Easy to remember superficial because start from medial epicondyle. First is musculus pronator teres, round pronation. Pronator teres. Start from medial epicondyle and goes to the radius. Function, pronation forearm. You can say pronation forearm in elbow joint. Next, again, remember all superficial from medial epicondyle. Musculus flexor carpi radialis. Medial epicondyle to the second metacarpal bone. Flexion hand in wrist joint. Flexion. And because this muscle is radial side, also abduction. Hand in wrist joint. Do you remember? Ellipsoid joint to movement. Next, after flexor carpi radialis, we have musculus palmaris longus. Start, flexor carpi radialis. This flexor carpi radialis. Next, little tendon, musculus palmaris longus, medial epicondyle and goes to the aponeurosis on the palm. Function, flexion hand in wrist joint. Next, musculus flexor digitorum superficialis. Flexor for fingers. It starts from medial epicondyle and goes to the fingers. This muscle goes below retinaculum flexorum, for tendon, and goes to the middle phalanx. When it goes to the middle phalanx, every tendon has 2 legs and attached to the every middle phalanx and form slit. Okay? So flexor digitorum superficialis can flexion only these parts. So this is flexor digitorum. This already another muscle, okay? Flexor digitorum only for middle phalanx. And next, last is musculus flexor carpi ulnaris, from medial epicondyle to the hypotenar elevation of little finger. How to remember? All muscles, superficial layer, from medial epicondyle. First is pronator teres, then flexor carpi radialis, last flexor carpi ulnaris. Between them, palmaris longus, flexor digitorum superficialis. Okay? Deep layer. Deep layer only 3 muscles. First is flexor for thumb. It starts from, again, medial epicondyle and goes to the distal phalanx. Musculus flexor pollicis longus, long flexor of thumb. Flexion of thumb and flexion of hand in wrist joint. Next, flexor digitorum profundus. Start from medial epicondyle, membrane between bones and ulna, and goes to the distal phalanx. So, superficial to the middle phalanx and deep flexor to the distal phalanx. You remember, superficial form 2 leg, and profundus, deep, goes between these 2 legs to the distal phalanx. Okay? So we have slit, hiatus tendinus, and there is tendon for superficial, for deep. Okay? So this is superficial, this is deep. Yes? Distal phalanx for deep. Now, so 2 muscle of deep layer. Flexor for thumb, flexor, deep flexor for finger, and last is musculus pronator quadratus. In the superficial, round, in the deep layer is square. Square starts from ulna and goes to the radius. Here, from ulna to the radius, and pronation. Posterior group. How to remember posterior group? Start from lateral epicondyle. At first, posterior group is superficial and deep again layer. Superficial we divided on radial part and ulnar part. Radial 3 and ulnar 3 again. Radial. Here is one trick. First muscle is musculus brachioradialis. Brachioradialis start from surface, lateral and little posterior surface of humerus, and goes and attached to the radius. So you will find this muscle here. And function of this muscle is flexion. Forearm in elbow joint. So posterior group but flexion. You remember anterior group only flexion. Now posterior group should be extension, but first muscle is still flexion. And feature for this muscle flexion forearm in elbow joint and set forearm by supination, but only in the middle position. With biceps brachii, pronation to the middle position, brachioradialis, supination till the middle position. So these 2 muscles set forearm in middle position. Okay? After brachioradialis, we have musculus extensor carpi radialis. We have 2, longus and brevis. Okay? Both here. First, short, brevis, start from radius. Long start from ulna. Goes and attached to the second and longus to the third metacarpal bone. Function both of this muscle, extension hand in wrist joint and abduction hand in wrist joint. Now ulnar group. Ulnar group we have first is musculus extensor digitorum. We don't have superficial or deep, just musculus extensor digitorum. Extensor digitorum start from membrane and ulna and go and attach immediately to the distal phalanx. So extensor digitorum 1 muscle, and we can move distal phalanx in this because of we have distal, attached to the distal phalanx. Next, musculus extensor digiti minimi. Attached to the distal phalanx of digiti minimi. So we have separated digiti minimi. And last is musculus extensor carpi ulnaris. Lateral epicondyle and to the 5th metacarpal bone. function: extension, hand in wrist joint, and adduction, hand and wrist joint. Okay, deep layer. Deep layer we have muscles only for these two fingers. First is musculus abductor pollicis longus, long abductor of thumb. Start from radius, goes and attach to the first proximal phalanx. You can find this tendon here. So if you find tendon here, it's here. Next, musculus extensor pollicis brevis. Start from radius and attach to the proximal phalanx. This tendon goes together with the tendon of abductor. So both of these, tendon of abductor pollicis longus and extensor pollicis brevis. What is here? Do you see? One tendon and second tendon. This is extensor pollicis longus. Why long? Because start from ulna and goes to the distal phalanx. Short from radius to the proximal. Long from ulna to the distal. First muscle of the body. First start from lateral epicondyle and goes to the radius musculus supinator. We have here pronator, here we have supinator. And last is musculus extensor indicis, second finger in Latin indicis, from ulna to the distal phalanx, and it has common tendon with extensor digitorum. So superficial layer 6 muscle, deep layer 5 muscles. Last is the hand. On the hand we have elevation of thumb, elevation of little finger. This elevation name tenor, this elevation name hypotenor. On the tenor we have musculus abductor pollicis brevis, musculus flexor pollicis brevis, musculus opponens pollicis, opponens means against another finger, and musculus adductor pollicis. We doesn't have brevis or longus. No short, no long, only one adductor. 4 muscle here, 4 muscle here. Musculus abductor digiti minimi, musculus flexor digiti minimi, musculus opponens digiti minimi, and musculus palmaris brevis. Here we have palmaris longus, here palmaris brevis. Between bones, at first we have musculi lumbricalis, lumbricalis like worm. And deeper between bones we have musculi interossei, 4 lumbrical, 4 interossal muscles. Now topography. Here we have axillary cavity. Medial wall, lateral wall, anterior wall, posterior wall. And this is apertura inferior and above apertura superior. What is in axillary cavity? In axillary cavity we have 2 foramen. Here is foramen quadrilaterum and this is foramen trilaterum. Here is tendon of triceps, long tendon, long head. Borders of foramen quadrilaterum. So how to explain? At first we have 2 muscles, musculus teres major and musculus subscapularis, goes and form with humerus triangle foramen. Humerus covered with coraca brachialis. So you can say lateral border is musculus coraca brachialis. And the tendon of triceps divided this opening on 2. Triangulare, foramen triangulare, and foramen quadriangulare. Square and triangle. So borders of square is triceps, coraca brachialis, teres major, subscapularis. Borders of triangle, subscapularis, teres major, and long head of triceps. We will use this opening for nerves and vessels. Topography here. We have sulcus medialis, sulcus lateralis between biceps and another muscles of shoulder. On the forearm, we have three grooves. First is sulcus radialis, sulcus medianus, sulcus radialis, sulcus medianus, sulcus ulnaris. Sulcus radialis bordered with brachioradialis and flexor carpi radialis. Then, after flexor carpi radialis, skip little tendon and take flexor digitorum superficialis. So, flexor carpi radialis, flexor digitorum superficialis. After flexor digitorum superficialis, we have flexor carpi ulnaris. This is sulcus ulnaris. On the hand, explanation. So, we have retinaculum flexorum below with 9 tendons. Flexor digitorum superficialis, 4 tendon, flexor digitorum profundus, 4 tendon, and 1 flexor digitorum pollicis longus, 9 tendon below retinaculum flexorum. And there are difference on the shelf around the tendon of these flexors. Shelf or vagina. What is difference? This chart. So we have flexor digitorum pollicis longus. Shelf pass below retinaculum flexorum. This flexor of superficial and deep flexors of finger. What difference is shelf continue to the little finger but stop half break with another fingers. What does it mean? If inflammation on this, second, third or fourth finger, inflammation stop here. But if inflammation here or here, inflammation can go to the retinaculum flexorum, and because shelf close to each other, inflammation can go to the another side, and from little finger can go to the another side, and we have looks like letter V inflammation. Okay, so like V phlegmon. Understand? Good. That's all. And there is a table of muscles of forearm from Anastasia Sergeyevna. We start learning about muscles of lower limb, musculi membri inferioris. Consist of muscle of pelvic muscles of pelvic girdle, musculi cinguli membri inferioris, and muscles of free lower limb, musculi membri inferioris liberi. First muscle is muscle of pelvic girdle. Okay. So muscles of pelvic girdle, we have anterior and posterior group. Anterior group, here, big muscle, like bundle. Musculus psoas major. Start from anterior surfaces of last thoracic and 4 upper lumbar vertebrae. Next is musculus iliacus. It placed here on the fossa iliaca. Start from fossa iliaca. Both muscles go here, unite, and form musculus iliopsoas. This is musculus iliopsoas. It goes here and attached to the trochanter on the femur. So, start separatedly, but then goes together. Below musculus psoas, we have musculus psoas minor. Musculus psoas minor start from anterior surfaces of bodies of last thoracic and first lumbar vertebra and attached to the pubic bone, to the eminentia iliopubica. But also this muscle attached to the fascia iliaca. And function of this muscle is stretch fascia iliaca. Some persons doesn't have this muscle. It's a rudimentary muscle. Next is posterior group. First posterior group is Musculus gluteus maximus start from outer surface of iliac bone and attach to the rositas gluten. Do you remember on the femur behind we have linea aspera? Linea aspera divided and attached goes to the trochanter major, trochanter minor. To the trochanter minor part named linea pectina, to the trochanter major to the rositas gluten. Attached to the rositas gluten. Function is extension and supination lower leg in hip joint. Below this muscle we have musculus gluteus medius and musculus gluteus minimus. Both start from posterior surface of iliac bone and attached to the fossa trochanterica. You remember between trochanter and neck of femur we have little bit, fossa trochanterica. Function of these two muscles. These muscles, anterior bundle can pronate, posterior bundles can supinate, and whole muscle can abduct, thigh and hip joint. Okay? And only this muscle can do this. Next is musculus piriformis. Piriformis start from sacrum, from anterior surface, ventral surface. Pass through the incisura ischiadica major. And this muscle feel this incisura, but not entirely. Above and below we have spaces, foramen suprapiriforme and foramen infrapiriforme. We will use the space for vessels and nerves. And go to the fossa trochanterica. This muscle function supination, thigh and hip joint. Next muscle, musculi gemelli, superior and inferior. Gemelli start from ischial tuberosity and spina ischiadica and attach to the fossa trochanterica. Function both supination, thigh and hip joint. Then musculus obturatorius externus and below is musculus obturatorius internus. Externus start close to the foramen obturatorium outside, internus from foramen obturatorium inside, from both. Both attached to the fossa trochanterica. Function supination, thigh and hip bone, in hip joint. Last is musculus quadratus femoris. Start from tuberus iavicum, attached to the crista and trochanterica. Function again supination, thigh and hip joint. So all of these muscles, supination only, easy to remember. Next is and the body. Last muscle is special. This muscle, or you can show this muscle, musculus tensor fasciae lata. Start from spina iliaca anterior superior and goes to the lateral surface on knee. So this muscle attached to this tendon. This tendon is tractus iliotendinous, iliofemoralis. Tractus iliofemoralis attached to the lateral surface. You'll find information like attached to the lateral condyle. It means not to the lateral condyle of femur. It means attached to the connective tissue that form tendon close to the lateral condyle. And then tendon goes farther to the tibia and fibula. So muscle affect not only this joint, it also affect on the knee joint. Function of musculus tensor fasciae lata is flexion, thigh in hip joint, and flexion and supination, lower leg in knee joint. Next muscles is muscles of thigh. So it was anterior and posterior group, now muscles of thigh. On the muscle of thigh we have anterior, medial and posterior group. Anterior group, first muscle is musculus sartorius. Musculus sartorius start from spina iliaca anterior superior and attached to the medial surface. On the medial surface we have structure named pes anserinus superficialis, like superficial goose feet, because it consists of three parts, looks like goose feet. And sartorius attached to the first part. Function of sartorius: flexion, thigh in hip joint, and flexion and pronation, lower leg in knee joint. After sartorius we have this big muscle, biggest muscle on thigh. This big muscle name, musculus quadriceps femoris. Quadriceps means forehead. This four separated head. First is musculus rectus femoris, direct muscle of thigh. Then we have belong musculus rectus femoris, musculus vastus intermedius. Medially musculus vastus medialis and laterally musculus vastus lateralis. Beginning, rectus femoris start from spina iliaca anterior inferior. Vastus intermedius start from line between two trochanter, linea intertrochanterica. Vastus medialis go behind and attach to the linea aspera, to the medial lip. Vastus lateralis goes behind and attached to the linea aspera, lateral lip. So this muscle like around thigh. Then all muscle fibers go and form common tendon attached to the patella. And then patella has ligamentum patella attached to the tuberositas tibia. Function of this muscle. Because of rectus femoris attached to the hip bone, muscle can flexion thigh in hip joint. And whole muscle extension lower leg in knee joint. Only this muscle can do extension for lower leg. Now medial group. Medial group move legs to each other. So these are adductors. So adductors. First is musculus gracilis. Musculus gracilis. Start from inferior branch of pubic bone and attached to the pes anserinus superficialis to the second part. Function. Adduction lower leg in hip joint and flexion and pronation, adduction thigh in hip joint and flexion and pronation lower leg in knee joint. After gracilis, here, medially from iliopsoas, we have musculus pectinus. Easy to remember. Pectinus start from pecten ossis pubis attached to the linea pectina. Pecten, pecten, pecten. Function of musculus pectinus. Flexion and adduction thigh in hip joint. Then three adductors. Adductor longus, adductor magnus, and below longus, deeper, we have adductor brevis. Adductor magnus start from upper branch of pubic bone attached to the linea aspera. Function, flexion and adduction thigh in hip joint. Adductor brevis start from inferior branch of pubic bone attached to the linea aspera. Function, flexion and adduction thigh in hip joint. And adductor magnus start from inferior branch attach again to the linea aspera but very low. Because of this cannot flexion, only adduction thigh in hip joint. Last group is posterior group. Posterior group for extension. So medially we have musculus semitendinosus and then semimembranosus. You can feel it at first semitendinosus, a little bigger, and behind and laterally is semimembranosus. This semimembranosus, behind and laterally. So semimembranosus start from tuber ischiadicum and attach to the pes anserinus superficialis, third part. Function, extension thigh in hip joint and flexion and pronation lower leg in knee joint. Semimembranosus start from again tuber ischiadicum and attach below pes anserinus superficialis. We have one more structure, pes anserinus profundus, only semitendinosus attached to this goose feet. Function, extension thigh in hip joint and flexion and pronation lower leg in knee joint. Laterally we have musculus biceps brachii. Posterior group. Musculus biceps brachii, biceps means two head. One head start from tuber ischiadicum again, second head start from linea aspera. and attached to the head of fibula. Function: extension tie in hip joint and flexion and supination lower leg in knee joint. So, and now you understand, if point of attachment here, flexion and pronation. Point of attachment here, flexion and supination. Last muscle is behind the knee, musculus popliteus. Start from lateral part of thigh, lateral epicondyle, and attach to the tibia. So, function, flexion and pronation, lower leg and knee joint. Now, topography. So, you already know about inguinal ligament. You already know about inguinal canal. What is below inguinal ligament? Below here, we don't have canalis femoralis because of it not present in normal state. This is only pathological state. So, how it forms? Below inguinal ligament we have space. This space bordered by arch, arcus iliopectinus on two spaces. Arcus iliopectinus between inguinal ligament and attached to the eminentia iliopubica. First space laterally below inguinal ligament. This is lacuna musculorum, muscle space. Lacuna musculorum fill in with musculus iliopsoas. And here we have nervus femoralis, femoral nerve. Medially space named lacuna vasorum. Lacuna vasorum for vessel. There is vein, vena femoralis, and artery, arteria femoralis. Vein is medially than artery. So, inguinal ligament goes to the pubic bone and turns. When it turns and form another ligament, another ligament named Jean-Bernard's ligament. Jean-Bernard's ligament, or another name is ligamentum lacunare. Then it turns and goes along the pubic bone. And this part of ligament has one more another name. This is Kupfer's ligament or ligamentum pectinum, pectinal ligament. So, inguinal ligament, Jean-Bernard's ligament, Kupfer's ligament. And here we have vein, vena femoralis. If another organ pass through this space, it forms hernia. If organ pass through this space, it forms femoral canal. So we don't have it in pathological state, we have it. So it doesn't exist in normal state. And we have picture. So this is hernia. This sac, which goes past through the and form femoral canal. So this is vein, vena femoralis, inguinal ligament, there Jean-Bernard's ligament, and below is Kupfer's ligament. Okay. Next. Now on the thigh, we have this triangle, femoral triangle. Femoral triangle, another name is Scarp's triangle, trigonum of Scarp. Border, inguinal ligament, musculus sartorius, musculus adductor longus. Bottom of triangle is musculus iliopsoas and musculus pectinus. In the center of triangle is groove for vessels. What vessel? Arteria femoralis and vena femoralis. First part of groove named sulcus iliopectinus. Then it goes to the sulcus femoralis anterior. Then vessel goes to the canal, like this or like this. This canal named canalis adductorius. Another name canalis vasto adductorius, canalis femora iliofemoralis. And Gruber's canal, 4 names. Border of this canal, medially musculus adductor longus, then musculus adductor magnus. Laterally is vastus medialis. Vastus medialis laterally. And between two muscles we have connective tissue, it's plate. Lamina vasto-adductoria. This is anterior border of this canal. That's all. So, next class we will learn about muscles. Tibia. Do you see? So, here is bone. Yes, it looks like in front. What we have for lower legs, anterior group of muscle, lateral group of muscle, and posterior group of muscles. Okay? So, anterior group of muscles. There are three muscles. Musculus tibialis anterior. How to find it? This tendon is musculus tibialis anterior. And here is venter of this muscle. It starts from tibia, from lateral condyle of tibia, and attach to the os cuneiforme mediale. Function: extension and supination foot in foot joint. Next, musculus extensor digitorum longus. Start from tibia and fibula. Attach to the distal and proximal phalanx of fingers. Function: extension and abduction foot in foot joint. And last muscle is this tendon to the first finger, big toe. How to correct in English? Big toe. Thumb is here.
Sorry, toe.
Big toe.
Toes and
Okay. In Latin it's hallucis. This is pollicis, hallucis. So musculus extensor, hallucis longus. This muscle below these two muscles, so you can show only tibialis anterior and extensor digitorum, and extensor hallucis longus below these two venters. But you can show tendon. Start from membrane between tibia and fibula, more from fibula, from medial surface of fibula. Attached to the proximal and distal phalanx of big toe. Function: extension of big toe and abduction foot and foot joint. So, function depends on point of attachment. This is a foot. If point of attachment here, it cannot abduct. It can extension and a little supination. Point of attachment here can abduct and extension of finger. And I forgot to say, not only extension of fingers, also extension of foot in foot joint. Okay, that was the anterior group. Now lateral group. Lateral group. Fibula, another name, peroneus. So musculus peroneus longus start from fibula above, from head of fibula and upper third. And musculus peroneus brevis start from middle part, middle third of fibula. These two muscles go behind the lateral malleolus, two tendons behind lateral malleolus. Musculus peroneus brevis attached to the lateral border, of foot. Peroneus longus goes behind to the malleolus, turn about lateral border and attach to the os cuneiforme mediale, like tibialis anterior, but below. Function: so it goes behind, attach this and turn. Function: abduction and pronation, foot in foot joint, both muscles. Now posterior group. Posterior group, we have superficial and deep layer. So this is superficial, this is superficial. Superficially, we have first muscle is musculus gastrocnemius and musculus soleus. Together, these two muscles form triceps for lower leg, triceps surae. In Latin, surae. So, one more time. Musculus triceps surae consists of gastrocnemius and musculus soleus. Gastrocnemius means two head, so it has medial and lateral head. Medial head start from like medial epicondyle, from popliteal surface above condyle, medially. Lateral head start from popliteal surface laterally. So start from femur. Soleus start from linea musculi soli on the tibia, behind posterior surface. Both goes to this common tendon, calcaneal tendon. Calcaneal tendon attached to the calcaneus. And below this triceps sura we have little muscle, musculus plantaris. So this is like a trip. Plantar here, what musculus plantaris here. Okay. Musculus plantaris start from lateral surface of popliteal surface and goes to the unit and form common tendon, tendon calcanei. So attached to the tendon calcanei and pulls. So this is flexion, foot in foot joint. That was superficial layer. Now, and special for this muscle, because it attached to the femur, so its effect on the knee joint. Separatedly, medial head attached to this place, so it can supinate and flexion. Lateral head can pronate and flexion, and plantaris same. Together, medial and lateral flexion, lower leg and knee joint. Okay. Now, deep layer. Cannot show deep layer except here, these tendons. These tendons behind medial malleolus. So, deep layer we have. If you remember anterior group, you remember deep layer of posterior group. Tibialis posterior, flexor hallucis longus, flexor digitorum longus. So, musculus tibialis posterior attached to the almost all bones, os cuneiforme mediale intermedius lateralia, os naviculare, and os cuboidum. Tendon goes behind medial malleolus. Function: adduction, supination, and flexion. Foot in foot joint. Why flexion? Because behind medial malleolus. So it pulls not like this. It pulls behind, it pulls this, because of this flexion. Next. Musculus flexor hallucis longus, attached to the distal phalanx. Beginning. Tibialis posterior start from tibia. Musculus flexor digitorum longus start from fibula. Flexor hallucis longus start from fibula. Flexor digitorum longus start between fibula and tibia, from both bones. Flexor pollicis, flexion of finger, and flexion and pronation, supination, foot in foot joint. And musculus flexor digitorum longus, attached to the fingers, it can flexion and adduction, foot in foot joint, and flexion fingers. Now muscles of foot. For muscles of foot, you should know only names. So on the arm, on the hand, we don't have foot on dorsal surface. For foot, we have one muscle on the dorsal surface. This is musculus extensor digitorum brevis. On the plantar surface, like on the head, on the hand, we have median, and lateral group. So, medially, muscle only for big toe. Musculus adductor, musculus adductor, and musculus flexor hallucis brevis. Adductor hallucis, abductor hallucis, flexor brevis. For lateral group, muscle for little finger. We can abduction, we can flexion, and we can opponents, digiti minimi. So we don't use this muscle, but we have it, all of them. And median group, we have musculus flexor digitorum brevis, musculus quadratus plantaris, and musculi interossei and lubricalis, like on the hand. And last part is Gruber's canal. So, Hunter's canal, Gruber's canal. Gruber's canal, this is canal between superficial and deep group of muscles. This canal starts from the popliteal fossa and goes to the foot for vessels and nerves. And this canal has two exits for nerves and little vessel. Canalis musculoperoneus superior and canalis musculoperoneus inferior. So canal itself between muscles and exit, two additional exits between fibula and muscle. So musculoperoneus superior and inferior. That's all. And I can show you
This one.
on the chart. So, musculus gastrocnemius. This is lateral, this is medial head. Both together gastrocnemius, part of triceps super. And here, musculus tibialis posterior and musculus flexor digitorum longus. If you can find musculus plantaris, like this little part, and then only tendon. Musculus plantaris is a derivative muscle. For example, do you know how in English this animal? Rabbit. So, do you remember leg of rabbit? It's very long.
Yeah.
So, in previous life we have this muscle on the foot, but now our foot is shorter. Musculus plantaris still start from femur. Okay? That's all.